Namaskara, I am Dr. Basuraj Kuntoji, consultant physician working at Manipal Hospital, Malleswaram. Today, I will be briefly speaking about dengue fever. As we all know, especially during the rainy season, especially since last 2 to 3 months, we are seeing more and more number of dengue patients. So, I will be talking specially to the non-medical person, patients and then families, how to identify the symptoms, signs and how to monitor the patients at home itself and when to admit such patients. Dengue fever, as you all know, is caused by mosquito bite, and after the mosquito bite happens, the incubation period from the bite till the symptom starts, it may range from 3 to 7 days. And after the incubation period, they generally develop fever, body pain, back pain, headache and myalgia. Dengue fever is also called as break bone fever. That means that they feel the pain as if the bone is broken. So most commonly they will have a severe headache, eye pain and the back pain along with the fever. And this dengue fever generally progresses in 3 phases. The first phase, what we call it as a febrile phase, which lasts for 3 to 5 days, sometimes up to 6 days. And as the fever subsides, the patients may land up in critical phase. So this is the most critical as well as the serious phase that we need to watch for, especially when the fever stops. And this phase lasts for 2 to 3 days and followed by the recovery phase that will happen. So during the febrile phase, I told you the symptoms, and one can also watch at home that whether they are able to eat well or not, whether they are able to hydrate themselves well or not, and if possible one can also check their temperature. Along with that, if possible, they can check the blood pressure as well as the heart rate also. So I would like to say that which patients we can still continue to manage at home and they can get cured at home itself. Especially the fever phase, as I said, it can last for 3 days, 4 days. As long as somebody is able to eat well, drink well, if they are not having too much of weakness as such, we can still continue to manage them at home itself. But however, if somebody feel very weak, very dizzy, unable to stand, possibly because of the low blood pressure, or if they have got a bleeding manifestations, mainly either from the gum bleeding or the oral bleeding or the bleeding in the urine or motion, such patients needs to be admitted. We are able to monitor the patients at home itself, and most of the patients have recovered at home itself without getting admitted to the hospitals. But however, as I mentioned, in the critical phase, very few patients we have seen having the critical illness also. These include, number 1, or all these critical illness also we call it as a severe dengue fever patients. And these include, number 1, bleeding manifestation. As I explained to you just now, bleeding can happen in the brain, bleeding can happen from the eyes, gum bleeding, oral bleeding, bleeding from the urine, bleeding from the motion can happen. So generally it subsides in general, but when it happens torrentially, it can be life-threatening also. The second complications that can happen during the critical phase of severe dengue illness is they can have accumulation of the fluid in the abdomen, chest, and they may develop breathing difficulty requiring oxygen support, sometimes NIV support, and sometimes they may require ventilator support. And the third critical illness symptoms that we are all worried is they may develop the organ failure. Organ failure, what I mean is they can have a dengue encephalitis. That means the patients may present with altered sensorium, they can have a fits attack, or they can develop the weakness of the limbs. Some patients can also have a kidney failure, so they may land up with decreased urine output, creatinine goes up and they may require a dialysis also. And some patients may have got a hepatitis with increased jaundice. And the fourth manifestation is they can have a low blood pressure. So these are all the severe dengue fever critical ill manifestations. But how do we know? Sometimes these can also give a warning signs. So it is also called as dengue fever with warning signs. Especially they can have a severe pain abdomen and their LFTs are deranged, and if these warning signs are present, they can land up with severe dengue critical illness symptoms and signs also. So these are the critical illness that what we are worried, and once these symptoms gets over, they start having a recovery phase. In the recovery phase, the patients can have rashes, the patient can have a itching sensation, and the heart rate also comes down. We have also seen asking for patients who are recovered, are there any post dengue complications like what we saw in some COVID and all. So generally dengue patients post recovery, they may have weakness for a week or 10 days and they completely recover back, and most of the patients do not have any dengue related complications. So this is a brief information about the progress of the disease, when to admit the patients and how long we can monitor the patients in the ward itself. The most important thing what everyone asks is about the platelet transfusion. As we all know, the platelet count is normally between 1.5 lakhs to 4.5 lakhs, and generally the platelet transfusion is required when it goes less than 10,000 platelet count. So if somebody do not have a bleeding manifestation and if the platelet counts are above 10,000, in such patients there is no need to transfuse the platelet. In the platelet, we have got two varieties of platelet. One is a single donor platelets, second one is the random donor platelet. So both have got equal effect, but however sometimes allergic manifestations are more seen in random donor platelet. So what I would like to say to the patients and their families is that dengue fever is a self-limiting disease, and one can continue to hydrate well and can eat lots of liquids, can take lots of liquids, fruits and fruit juices, and majority of the dengue patients will recover. Thank you.